or 2 seconds, that was sort of going down. I want you to think like a kite. Your head's follow there's a little guiding direction in my hands. So I want you to, like a kite, to think up, and your spine is going to be the tail of the kite floating up and not sticking. The bottom doesn't have to stick out. It's the knees that float as they just bend. But neck free, head forward, and then you just bend your knees quite quickly. That's it. And then to stand, we go low, quiet, neck free, stay back in your back, and up, to go up. And then we wait, soft legs, even if we just flash on all the areas, allowing neck to be free, head to balance up, letting the torso lengthen, soften, and widen, and widen. That's it, and wide. So you can allow your neck to be free. During the movement, I want you to come into that hinge. That's lovely, and bend the knees quite quickly. Well done, that was easier, wasn't it? Yes, lovely.
So I've just washed my hands. So I'm going to start on the forehead area, so which is zone 1. And as I work my hands over your skin, I can feel it's really nice and smooth to touch, which is fantastic.
Oh, thank you.
And are you exfoliating your skin at the moment as well?
Not that much.
No? So that's something that we can definitely look at to make sure that your skin stays really nice and smooth. And the great thing with exfoliation as well is it's going to be one of the key products for you to use to combat that pigmentation. So really great around the eye area, seeing just a little bit of dehydration just through there. Are you currently using an eye cream at all?
No, I've never used an eye cream.
Great, so we can look at incorporating that into your home care. That's just going to help to hydrate the area, plump out any fine lines that we're seeing as well. And just a little bit of dehydration there on zone 8. So coming down onto zone 9, which is your cheek area. So again, really nice and smooth to touch. Can see a little bit of that pigmentation that you're concerned about. Are you wearing an SPF every day?
I am, but just in my tinted moisturiser.
Just in the tinted moisturiser. So great to hear that you are using some form of sun protection. However, I'm going to recommend something for you to incorporate into your home care to really protect you from the sun, but it's also going to help to prevent any further pigmentation on your skin. Just having a look around the lip area, so really nice and clear. You did say one of your other concerns was some congestion and some hormonal breakouts. Where do you tend to usually get that?
Usually in my T-zone.
In the T-zone?
Yeah.
So that she's changed forever. And when you know that's happened, when you know that's true, when she knows it's true, try to go back to the old way and notice what happens instead. That's right. And when you're ready, and only when you're ready, all I want you to do is begin to move forward through your very first memory, completely integrated with her. Take her in your arms, hold her to your heart, feel her shrink down inside of you where she's surrounded by all the love, acceptance, forgiveness, safety, joy, strength, courage, wisdom, excitement, passion, all the good things that are about her that she could ever want or need. An endless, unlimited supply. And feel the two of you moving together as that little spark takes on a body. That body grows into a beautiful little girl, taking on all those memories. Notice how all the memories and all the experiences she encounters from that moment forward are perceived differently because she's different now. And notice yourself moving through each memory, and each memory as you move back to the present moment, only at the rate and speed that's right for you, only the rate and speed that's natural for you. Every now and then, after one of those key memories, you stop and you look back.
Muito bem. Para esse exame da sensibilidade dolorosa, ele não dói efetivamente. Ó, é um palitinho normal. Eu vou encostar ele em ti, ó, não dói. Tá doendo? Não, como eu falei. Eu vou identificar, pedir para te identificar se eu estou encostando em ti com 2 palitinhos ou com um palitinho só. Eu vou trabalhar com uma mão por vez. Então, vou começar por essa aqui. Tu fecha os olhos. Isso. Então, vamos lá. 2. 1, 2, 2, 2, 1, ok. 1, não. De novo. Letra T. Ok. Agora, tu continua de olhos fechados. Eu vou trabalhar com a identificação de alguns objetos. Então, eu vou te dar objetos, você vai manusear eles e me dizer o que são. Então, eu vou trabalhar primeiro com essa mão aqui. Esse objeto. Pode fechar. Identifica o que é. Uma bolinha. Correto, uma bolinha. Agora o segundo objeto.
8 millimeters. And you're going to have your client close their eyes. Okay. And I simply want you to tell me if you feel 1 point or 2 points.
Okay. 1, 2, 1, 2, 2, 2, 1.
So, for a correct response, you're going to test them about 10 times. 7 out of 10 is correct. For her, when I got to 7, she was correct. There was no need really to continue to go on, okay? Some will, if they're getting every one correct, especially starting out at 8.
Yes. Well, you're supposed to take the highest brachial. Yes. Yes.
On the skin, but I've literally just increased that a little bit with a professional exfoliator, and that is that slight tingling sensation that you will feel today. So a professional exfoliator is full of lactic acid, which I said is very exfoliating but hydrating at the same time.
What is this device that you're using now?
Okay, this is basically called a BT micro machine. What it actually does is, because our treatment's only 20 minutes long, we still want that result from having a mask on your skin for about 10 to 15 minutes. So this machine basically pushes this mask away from the actual machine deeper into the skin so that we can still get...
For any calluses, ulcers, or blisters. Nope. I see just a little bit of callus here and here, but that's okay because those are protective. I don't want you to take those off. Leave those there. It's also really important to check between the toes, looking for any dry skin, cracking, even skin breakdown there. A lot of people forget about that area. And I'm also looking at your nails. I'm looking for any ingrown toenails or extra thickness that would indicate a fungal. Okay, last I'm going to check your musculoskeletal strength. I want you to push down your foot against my hand. Very good. And pull back. Okay. And I didn't notice any problem in your gait or balance as you were walking in. Have you noticed any problems with that?
No.
Okay, good. All right. So, like I said,
turn it like this so that I'm releasing the sternocleidomastoid muscle, and now I can get my hands around it. The most superior part of the anterior cervical chain is right here, and when you have anything draining intraorally, you're going to start getting some enlargements of these lymph nodes in this area. Now you can look at the posterior lymph node when it's released like this as well, but it's often easier to do it on the patient on the other side. After you do that, you turn the patient around and you do exactly the same thing here, where I'm releasing the muscle on the left side and then examining the posterior part of the cervical chain over on this side. After this, I'm going to have the patient swallow, make sure everything is mobile, and then I go to the posterior part of the angle of the mandible, work my fingers down towards the apices of the front of the mandible, somewhat underneath and here as well, just to make sure things are mobile, and I'm going to wind up at the joint. Please open. There are 2 ways at least of taking care of the assessment of the joint. I prefer to have my fingers behind the patient's opening joint, and that way I can feel what happens very clearly when the patient is opening and closing. Open and close, please. The other way of assessment, You can put your hands here, but what you're really feeling is changes in the muscle.
Level 1, which is the submental and submandibular lymph nodes, and also feel for the submandibular gland. Next, feel the level 2 lymph nodes, which are the upper jugular nodes. Then the level 3 lymph nodes of the middle third of the jugular, moving on to the level 4 nodes of the lower jugular. Palpate the posterior triangle of the neck, which is level 5. Then palpate the central area of the neck, which is level 6, the postauricular and preauricular lymph nodes, and also to feel over the parotid gland for any masses. If you were to find a lump in the neck, fully examine it as you would in
which is the margin of the mandible, the midline, and the anterior border of the thyroid cartilage. Level 2, which is the upper jugular nodes. Level 3, which is the mid-jugular nodes. And level 4, which is the lower jugular nodes.
And the superficial masseter, anything triggered there?
It's a little mild.
Mild, but not referring?
No. I'd say that's moderate. It's local.
Okay. Deep masseter, moderate, but not referred. Anterior temporalis, we're checking now.
Frontal sinuses located behind the forehead, the ethmoid sinuses, which are behind the bridge of the nose, just beside the orbits, and then the maxillary sinuses, which are behind the cheek. And so those should be palpated if the patient has any complaints of sinus infections or sinus tenderness. The maxillary sinuses can be palpated here for any tenderness, and also here for the ethmoid sinuses, and here for the frontal sinuses. The sphenoid sinus is located deep behind the eye, and the patients with sphenoid disease will often complain of a very deep-seated eye pain. Next, we're going to do a palpation of the neck. We start with the cheek area. This is where the parotid salivary glands are located, and those should be palpated for symmetry and for detection of any masses. Most masses within the parotid salivary gland are benign. Go ahead and open your mouth. And this is where the temporomandibular joint is. It's a common area for dysfunction and pain. And you can often, in patients with TMJ syndrome, there will be a click here and some pain with opening. Go ahead and close. And then move down and palpate the submandibular area. The submandibular salivary glands are right underneath the mandible. They should be soft and symmetric. If there's any enlargement or nodularity, that's abnormal. That's a sign of either chronic inflammation or possibly a tumorous growth. And go ahead and move your way back toward the posterior triangle of the neck. This is where the sternocleidomastoid muscle inserts. And there are many lymph nodes that are potentially enlarged in the neck.
Sinuses, any tenderness? Nope. Okay. Good. Now I'm just going to visualize your sinuses. Okay, lean your head back, please. Okay. Good. Nasal mucosa, nice and pink. See your turbinates are patent, no polyps. I'm going to go on the other one. And pink mucosa, turbinates patent, no polyps. Okay, good. All right. And now I need to look inside your mouth. Any problems with your mouth, teeth, gums, throat? No.
This time.
Okay, good. Lips are nice and pink and moist. And look inside your cheeks here. So. All right. I'm just going to look at your buccal cavity, buccal area, nice and pink. And stick out your tongue for me. Okay, good. Say ah. Ah. Okay, good. Uvula is nice and midlines. Tonsils are +1. Okay, underneath your tongue. Perfect. No lesions or nodules or anything there. Teeth look nice and healthy. Go to the dentist regularly?
I do.
You do? Oh, okay.
I do.
Okay. Good. Yeah, you have beautiful teeth.
Every 6 months.
Okay, good. And also I saw your hard palate has good architect and color, and your soft palate was was nice and healthy and pink, and without exudate or any white stuff in the back that could indicate like an infection or strep throat.
Oh, good.
Yeah, and now I need to palpate your lymph nodes. Any problems with your lymph nodes or tenderness in your neck? Or
No.
okay, so palpate your occipital lymph nodes. Okay, good. And your post-auricle, your pre-auricle. Let me know if you feel any tenderness. Okay.
Okay.
Okay, good. Your tonsillar, your submandibular, your submental, and your cervical. I'm going to go all the way down to superficial, posterior, deep chain.
I'm just going to palpate your tragus, okay? Is there any pain as I do that? No? Okay, very good. And very good. Okay, now to continue with your auditory examination, I'm going to do the finger rub test. Okay, so if you don't mind, when I rub my fingers, tell me which side you hear the rubbing on. Okay.
On my right side.
Very good.
My left side.
Good. Okay, now I'm going to go ahead and conduct the Rene and Weber test. Okay. So I'm just going to ask you to tell me when you can't hear the noise. Okay. Okay, how about now?
No problem. Yeah, good. Your ass is good. Not so many problems. Around here, right? Here, right? This one, right? This have a hollow. What is it? This one, the bone. I don't know. You don't know? You see? I put the three things, right? Down here. Yeah, right? Yeah. This one, here. If you're not touching, you don't know, right? You touch it, then you know, oh, here. Here's a pig. The bone. Yeah, right? Yeah, here. Sometime.
I don't have time.
Okay. Here, right? Time you feel, right? Don't drink it.
I have a problem.
Yeah, so now heat in. You want to heat in?
No.
No? Okay. Just hand, okay? Too warm, right? For the treatment, the water.
What?
Well, just for the treatment, yeah, for the massage.
Wait,
That's
you
it.
look
Yeah.
weird.
Yeah.
Just extend your hands here, and this is just a little bit of a radial pulse. You're gonna, using your middle finger and your index finger, you're gonna place them on the radial pulse on both sides, and you're checking for whether the patient's pulses are regularly regular, regularly irregular, irregularly irregular, and symmetric.